So we're going to shift gears. On your program, it had Ms. Jasmine Long as representing Birthing Beautiful Communities. Unfortunately, she could not be here today, but we do have another representative from the organization, Tammie Jones. So her bio is not listed in the program, so I'll just go over really quickly. She's been with the group since December 2020, Birthing Beautiful Communities in Cleveland, Senior Director of Programs and Behavioral Health. So she is absolutely the right person to be here to talk about the behavioral health. Been working in the field of birth, maternal mental health wellness for over 20 years with the Cleveland Department of Public Health. So really been here in this community. So you know the communities here, and that's fantastic. Also, advanced grief recovery method specialist, bachelor's degree in business administration from University of Toledo, master's degree in business management from Indiana Wesleyan University. And more than anything, I'm just delighted you're here to talk with us, particularly around these issues around birth in a time when people can be stressed. So thank you.
Good morning, everyone. So yes, I'm from Birthing Beautiful Communities, and we are a doula agency that assists moms with doulas and perinatal support, addressing social determinants of health that impact infant mortality. And I would like to add to that and impact their mental health as well. We are a holistic program, support program, and helping and supporting women to deliver healthy babies, full-term babies, and to achieve equitable birth outcomes. So in order to do that, the moms come to us broken, stressed, depressed, and not knowing what the next steps are. So my program is called Our Wellness Network. It is a network of approximately 35 individuals who are peers, clergy, or licensed therapists who have all been certified as grief recovery method specialists. I am one of those. I see someone in the audience who is one of my specialists, and also some colleagues here as well. What we do is offer this workshop, which is 8 weeks in length, and we talk about healing and talking about the undelivered messages that we have with someone that we have lost. So grief is underhandedly the reason for a lot of our anxiety, a lot of our stress, a lot of our depression. So the moms come to us saying that they're okay, but their actions, dictate something else. So we really take them under our arms and we really coach them and walk with them throughout their pregnancy journey until the child turns 1, making sure that their mental status is okay. Many of them say, oh, the child is fine, but what about me? You keep asking about the baby, but no one asks how I'm doing. I had a call from a young lady and she was like, the baby's fine. Stop asking about the baby. What about me? I said, well, let's talk about you. She wanted to talk about her hopes, her dreams, her realities. I want to buy a house. How do I go about buying a house? And so I'm like, oh, okay. And so that's when I decided that this program was just more than talking about mental health. We actually had to talk about the whole person. So we offer classes to our clients on Wednesday evenings, and it's our breathe classes. We encourage you to breathe. Breathe out the stress, breathe out the anxiety, breathe out the depression. And with that, we also talk about some other things. They asked for a class on boundaries. I created a class on boundaries. They asked for a class on grief and loss. We created that class. We created a class on stigma. And I think my favorite class to date, too, is healthy relationships, managing difficult relationships for not only you and the significant other, but you and your siblings, you and your parents, you and your coworkers. How do we do that? And my other favorite class that came out of this was financial literacy. That is a huge stress for all of us, but definitely for our moms who this is baby number 1 or baby number 4, and there is limited support. There may be not a full-time job, a part-time job, if there is any real income coming in. So really talking to them about, where you at today. It's not a place you have to stay at, that you can move forward with steps. So we partner with Huntington Bank, and we come and do this financial literacy series on a quarterly basis. So I'm hoping that the impact that we're making is we don't just care about your baby. Your baby is, yes, important, but in order for your baby to live, I'm trying to help you live as well. So my questions, if you could wave a magic wand and have all the funding resources needed to solve the problems of disparities in maternal mental health, what would your first steps be? And what would you recommend the average layperson to do? So we are, doing grief recovery with the ladies, but we also connect them to individual counseling services. And these are with counselors who look like us. And so therefore, they leave the hospital and they are connected to a psychologist or psychiatrist, but they don't look like us and they don't, want to continue with services with them. So we, convince them, and I don't want to say convince. The first thing we have to do is show ourselves friendly. They're coming to us, and the first thing they want to know, do you really care about me? So it's building relationships with individuals and saying that you really care about me and what's going on with me and with my child. So that is some of the things that we are doing. Yes, I'm loving some of these responses. These are things that we're working with our agencies and with our partners to try to integrate, mental health support throughout the entire pregnancy journey and not just after I had a baby. I have the baby, now what do I do? Let's start that in the beginning. My next question is, how can we work to broaden our understanding of paternal mental health and work to identify culturally based community programs and resources for those affected? We cannot forget about the fathers. The fathers are the non-birthing parent, but the fathers is just as important as the mom. His mental health, we're just overlooking it. Oh, he doesn't want to be involved. He has his own thing going on. Dad is scared. Dad is running to the hills because he doesn't have that support. He doesn't know where to go. He did not have a father figure growing up, and maybe he did have a father figure, but this is his experience. So we need to wrap our arms around him as well to make sure that he is supporting mom and the child. So dads go through depression and anxiety because they want to have a greater impact in that child's life. So we definitely have to have programs supporting our dads. Thank you.
Ms. Jones, I loved so much of what you said. I had no idea that you run these evening classes on things that can reduce the stress that then could reduce the possibility of mental health crisis. So I think that's fantastic. I saw one thing that came through about integrating in high schools and schools a little more about some of these life skills. It's fantastic, and thank you for remembering the dads. I know that when my kids were born, that was also a difficult time and challenges. So your group does such great work. So thank you.